In this video, we will be learning donning and doffing for healthcare workers, doctors, nurses or anyone working in healthcare which is the part of WHMIS. Please subscribe the channel. List of the PPE for healthcare workers. Eye protection if risk of splashing. Fluid repellent face mask. Apron. Gloves. Disposable goggles or full face visor. FFP3 respirator mask. Long-sleeve disposable gown. Gloves. Apron. What is the correct order to don and doff PPE? Donning means wearing the PPE. Doffing means removing the PPE. Image result for do and don't for health workers in PPE settings. Perform hand hygiene. Put on your gown, fully cover your torso from neck to knees and your arms to the end of your wrists. Fasten the gown behind the back of your neck and waist. Put on your respirator, cup the respirator with the nosepiece at your fingertips and the headbands hanging below your hands. Donning sequence. 1. Perform hand hygiene. Wash hands or use an alcohol-based hand rub. 2. Put on gown. Ensure the gown fully covers the torso and neck to knees, arms to end of wrist and wrap the around the back. Fasten/tie at the back of neck and waist. 3. Put on mask. Surgical mask or particulate filtration respirator or equivalent surgical mask. Secure ties or ear loops. Mold the nosepiece into the mask. Position surgical mask over nose, mouth then chin. PFR. Position according to training and manufacturer's instructions. Perform fit check. 4. Put on eye protection. Goggles, safety glasses, or face shield. Place over face and eyes. Adjust to fit. 5. Put on gloves. Fit gloves over the cuffs ensuring the gown sleeves are covered by the glove. 6. PPE check. Check all items of PPE are correctly in place. Check integrity of PPE. Note, do not touch mask or eye protection again once PPE check has been completed. Doffing steps. Begin PPE removal at person's doorway. Eye protection and mask/respirator to be removed outside the room. Outside surfaces of PPE are considered to be contaminated. 1. Remove gloves. Grasp outside with opposite gloved hand, peel off. Hold removed glove in the gloved hand. Slide fingers of ungloved hand under the remaining glove at wrist. Peel glove off over first glove. Discard gloves in waste container. 2. Perform hand hygiene. Wash hands or use an alcohol-based hand rub. 3. Remove gown. Undo fasteners or ties. Pull away from neck and shoulders. Touching inside of the gown only. Turn gown inside out, away from clothing. Fold or roll into a bundle and discard in waste container. Note, eye protection is to remain on at this stage. 4. Perform hand hygiene. Wash hands or use an alcohol-based hand rub. Note, if practicing PPE optimization. Stop doffing at stage 4. Check PPE for any integrity breaches or visible contamination. 5. Remove eye protection. Goggles, safety glasses, or face shield. Do not touch the front surfaces. Handle by headband or side arms. Place in designated container for reprocessing or in waste container. Note, remove outside the person's room. 6. Perform hand hygiene. Wash H7. Remove mask. Surgical mask or particulate filtration respirator. Do not touch the front of the mask, grasp lower, then top ties or elastics and remove as per training and manufacturer's guidelines to avoid self-contamination. Discard in waste container. 8. Perform hand hygiene. Wash hands or use an alcohol-based hand rub immediately after removing all PPE. Hands or use an alcohol-based hand rub. Duties of employees regarding PPE. PPE should be returned to the appropriate storage unit after use, unless the employee takes their PPE home, for example footwear or clothing. PPE must be visually examined before use. Any loss or obvious defect must be immediately reported to their line manager. Quiz on PPE donning and doffing. 1. True or false, the correct sequence for donning PPE is the following: gloves, mask/respirator, goggles/face shield, gown. The answer is false. 2. After providing care to a patient with chicken pox, you remove your PPE. Which statement is true about PPE removal? A. After removing PPE, it is best to perform hand hygiene with hand sanitizer when the hands are visibly soiled. B. It is best practice to remove all personal protective equipment in the patient's room. C. When removing PPE, the respirator should be removed outside the patient's room. D. All the statements are true. The answer is C. When removing PPE, the respirator should be removed outside the patient's room. 3. A patient requires nasal tracheal suction. The patient is receiving medical treatment for Mycoplasma pneumonia. Select the PPE you would wear for this procedure. A. Gloves and mask. B. Gloves, gown, goggles, and mask. C. Goggles and mask. D. Gloves and goggles. The answer is B. Gloves, gown, goggles, and mask. 4. Referring back to question 4, in what order would you doff the PPE? A. Gloves then mask. B. Goggles then mask. C. Gloves, gown, goggles, and mask. D. Gloves, mask, goggles, then gown. The answer is C. Gloves, gown, goggles, and mask. 5. When removing PPE, it is important to know what areas of the PPE are considered clean vs contaminated. Select all the areas on PPE that are considered clean. A. Ties on the gown. B. Outside of the mask. C. Sleeves of the gown. D. Back of the gown. E. Inside of the gloves. F. Straps on the goggles. The answer is A. Ties on the gown. D. Back of the gown. C. Sleeves of the gown. B. Outside of the mask. E. Inside of the gloves. F. Straps on the goggles. 6. One important type of personal protective equipment is a respirator. Which statement is false about a respirator? A. A respirator is to be worn at all times when a patient is in droplet precautions. B. It is important to be fitted for a respirator annually by your employer. C. After donning a respirator, the nurse must perform a seal check. D. After providing patient care, the nurse will remove the respirator outside the patient's room. The answer is A. A respirator is to be worn at all times when a patient is in droplet precautions. 7. True or false, the nurse should always don personal protective equipment in the patient's room. Answer is false. Please subscribe the channel. You will see a full training video on doffing and donning.